Good morning. Joining us on the phone, always fun to talk to the Ogle County Health Department. Grant Coordinator Joyce Lewis, Manager of Grants and Special Projects Laura Dinderman, and Public Health Specialist Aaron Lamb. Good morning, ladies.
Good morning.
Oh, all in unison. That was nice. Ogle County Health Department, of course, your home for anything you need in and around Ogle County to make yourself and your family better. You guys have a ton of exciting programs coming on, whether it's stuff for children, stuff for those of you getting on in years. And now you guys have something new coming your way in regards to a large grant that's going to help you guys out with some things. Joyce, first off, tell me what this large grant is for.
So the grant is called the Action Grant, and it is funded through the CDC. It stands for Addressing Conditions to Improve Population Health. It is a grant that we were gifted $500,000 per year for up to 3 years, so we can get some programs put in place to help the people in the counties of Ogle, Lee, Whiteside, and Carroll.
Now, Laura, with this grant, you guys obviously do a lot of these same things already. How is this going to improve what the Ogle County Health Department does?
We are going to be taking a specific focus on food and nutrition security. So it is just going to really emphasize initiatives that we already have in place and then also adding some new ones. So one of the things that we really want to get started are mini food centers. And this is something that we have actually talked about with you guys before back in October. And we're still working on some of the logistics of it, but we will have one mini food center place in each county throughout this first year. And then we also are looking to expand on the food pantry access in each of the counties throughout this first year as well, whether that be adding new ones or maybe just increasing the existing hours of ones that are already in place. We are also looking to maybe possibly get some food bags in the hospitals for patients to take home when they are discharged from the hospital so that they can focus really, on their recovery and not, have to focus on where they're going to be receiving their next meal. Those are our main goals, and also increasing the education and reducing the stigma associated with receiving any assistance, especially in relation to food assistance.
Joyce, what can you tell us about some of the education programs that you guys have planned for the coming year?
They will be provided by the University of Illinois Extension Office. The classes are free to everyone. The first class is Healthy Sense. So Healthy Sense is all about educating people about nutritious foods and helping people improve their health and wellness. The U of I Extension educators will teach people where to buy and how to grow food, how to afford and cook the food, and how to have the time to manage it all. Healthy Sense 5 main points that will be addressed are making healthy choices on a budget, decreasing food expenses, developing a food budget, planning a meal or meals, and food shopping on a budget. The curriculum will be available and is beneficial for people on all income levels and all age groups. So the first class for Healthy Sense will start February 29th, and they will be conducted every other Thursday for 6 weeks and held virtually from 3 to 4 p.m. The registration information for these classes will be available on our Facebook page and the Ogle County Health Department website under the Food and Nutrition tab later this week.
That sounds like something a lot of folks could be interested in. Now, Laura, what type of classes are the ones that are called Homegrown Healthy that you guys will be helping arrange?
Yeah, so also in collaboration with the University of Illinois Extension, we'll be offering another curriculum, and this one is titled Homegrown Healthy. This will be a curriculum that is going to be more so focused on getting the family involved, and this will be based on growing food and crops, and will follow the plant throughout the growing season, following the seed all the way through to food preparation and storage, and also incorporating the use of hydroponics. This is a very in-depth course and will be a 10-week session. The classes will be 60 minutes long, and these are projected to start by the end of May. These will be taking place in person and will only be taking place in 2 counties during this first year of our grant period, and then expanding out into the 2 other counties of our catchment area. And those counties have not been yet decided, but we will have further information on that. And again, those will be updated on our Facebook and website.
Public Health Specialist Erin, thank you for being with us. Now, since you guys do cover a lot of needs in the community from varying degrees of health, what are some of the nutrition aspects and food scarcity issues that you have seen when interacting with the community?
Excuse me. There is a lack of nutritious food choices in most of our towns in each county. We are just choosing what we feel is the number one town in each county to service with our food centers. And to help provide families with more nutritious choices that can't necessarily get to a grocery store, instead of choosing something in their fridge that might be less healthy or nothing at all.
It sounds to me like maybe you are just against frozen foods in general, and I'd like to stand up for them just briefly.
They're not all bad.
They're not terrible.
I want to substitute apples and other vegetables for the Cheetos that some people might prefer, giving them those nutritious choices.
I am 70% potato chips, just so you know. Ladies from the Ogle County Health Department joining us. Big grant coming your way. Again, $500,000. How long is this grant going to last you guys with this program?
So each year is funded October through September, and then so our first year of this grant will end in September of 2024, and we are projected to be funded through September of 2026.
So it gives you a couple of years to help make an impact in the area and getting people better food choices. So let's talk about these local food center ideas you were talking about. What is that exactly?
Yeah, so these would be a small refrigerator, and then also with a smaller dry foods pantry placed in one of the towns throughout each of our counties, basically just as a place where people can come and grab some fresh produce, maybe some protein, anything that we see is kind of very hard to find in the area. For example, we have places that you have to drive 10 to 15 miles to be able to purchase a pepper or a banana, which is kind of outrageous, but that's just kind of the nature of being in this rural area. And so just something to get those nutritious foods into the area. These would be stocked by the health department for this first year, and then we would begin looking for sustainable sponsors or places to take care of these throughout the following years. But yeah, just a place where people can come and enjoy some fresh produce, things like that, so that they can, get some more nutritious foods.
That sounds amazing and a great way to care for the health needs of people in the area. Joining us this morning on the phone, Joyce Lewis, Laura Dinderbin, Erin Lamb. Thank you, ladies, so much for joining us. You have a great day.
Thank you.
You as well.